Hi, folks, welcome to the new episode of the Braces Talk. Today's topic is preventive orthodontics. Now, preventive procedures are taken in anticipation of development of a problem. Means if we are thinking that a malocclusion can occur, then what are we doing to prevent it? That is called preventive orthodontics, whereas interceptive orthodontics are the procedures which are taken when the problem has already manifested. So now moving on to the objectives. First is the parent and patient education. Second is supervision of the growth and development of dentition and craniofacial structures. Third is diagnosis and treatment procedures to prevent the onset of our anticipated malocclusions. So, when we include all these things, we can make the definition of preventive orthodontics as the branch of orthodontics which deals with the parent and patient education, supervision of growth and development of dentition and craniofacial development, and diagnosis and treatment procedure to anticipate any onset of malocclusion. First, we will deal about parent and patient education. Expecting mothers should have a proper balanced diet, nutrition, to have an ideal environment for developing fetus, and they should avoid certain drugs which are teratogenic in nature. Now, what is teratogens? That causes any malocclusion to the developing embryo or fetus. And soon after the birth, there should be proper nursing and care of the child. Even if the child is having any kind of food or breast milk or bottle milk, the gum pads of the child should be taken care of. They should be cleaned properly with the help of a soft gauze piece. If the baby is getting bottle feed, we should try to use physiological nipple, not conventional nipple, which otherwise it can lead to various orthodontic problems. Now, what is a physiologic and a conventional nipple? New orthodontic nipple design has a superior design than conventional natures. They permit suckling by movement of the tongue and the lower jaws. Peristaltic pulse is the most close to a biological breastfeeding. It helps in opening the lip, have a peristaltic tongue movement and suckling, which allows the perioral muscle to develop and it comes with a certain guidelines of giving the nipple at the age of 0 month, 1 month, 3 months and 6 months. The kind of round hole, punched hole, Y out helps in proper oral exercises. Last one is the use of pacifier. The pacifier should not be used for a longer time. Next up is the caries control. Caries in the proximal surface of deciduous teeth, if not restored, can lead to loss of arch length by movement of the adjacent teeth into the space, and thus arch length discrepancies can occur, and when the larger permanent teeth erupt, they will not get proper spaces, which can lead to crowding in the further time period. Stainless steel crowns are provided to give an integrity to the tooth structure. All efforts to prevent early loss of deciduous teeth should be made. Simple preventive procedures like application of topical fluorides, pit and fissure sealants should be applied to a deciduous tooth. Now, any kind of supernumerary teeth or supplemental teeth can interfere with the eruption of the nearby teeth. They should deflect adjacent teeth and they can erupt in abnormal positions, leading to the permanent teeth to have a abnormal or ectopic eruptions. They should be identified and extracted before they cause any kind of malocclusion. Ankylosis is a condition where the periodontal ligament is absent and the tooth is binded to the bony structure. They don't resolve, hence preventing the permanent teeth to erupt, and they deflect them to erupt in abnormal positions. They should be removed surgically at appropriate time to allow the emergence of the successor. Only if the permanent teeth is there, we should first take a radiograph to see if the permanent teeth tooth bird is present or not. If it is present, then we should extract it. If not, then we should leave the tooth as it is, because it will give the maximum amount of anchorage and can prevent any kind of bone resorption. Parents should be aware of the tooth shading timetable. What time a primary tooth should erupt and what time there should be the shading of teeth. Any disturbances in it can lead to malocclusion. Disturbances, for example, delayed eruption of permanent teeth or delayed shading of primary teeth or early exfoliation of primary teeth. This all can lead in a combination to create a malocclusion. Identify and stop habits such as thumb sucking, nail biting, tongue thrusting, and lip biting. Prevention starts with proper nursing nipple and pacifiers to enhance normal function and deglutition activity. If any habit is there, we should go for prevention of habits by giving remainder therapy or punishment therapy to the patients. Cuspal interference should be removed by selective grinding. We can check for selective grinding by placing any kind of biting papers. Any problems like deviation in mandibular path of closure or bruxism can be detected earliest. Articulating papers can be placed in between the occlusal surface and we can ask the patient to do a selective grinding. The portions which will be having occlusal prematurity will have a darker shade in color. Next is the Milwaukee brace damage. Orthopedic appliances used for correction of scoliosis. It applies tremendous force on the mandible and occlusion, leading to retardation of mandibular growth and deformities. When such appliances are used, occlusion should be protected by using functional appliances. But these appliances are very rarely used in today's time. Lastly, any kind of premature loss of deciduous teeth can lead to drifting of the adjacent tooth in the space. In such condition, space maintenance should be inserted to protect the integrity of the arch length. Now, space maintenance are of different kinds. It can be fixed or removable. These are of lots of type which we will learn in my next episode. We will learn about the indications, advantages, disadvantages, types of space maintenance in the next episode. So, if you like this chapter, please like, share, comment and subscribe to my channel, The Braces Talk. Thank you.